put on there pretty good.
Today I'm going to explain and show you how to start an IV. Okay. First, you want to ID your patient, wash your hand, and put gloves on, and get all your supplies. Then you want to find your IV insertion site. Put the tourniquet on the patient's non-dominant hand, and you want to avoid friction and shearing of the skin. And the tourniquet should be placed 4 to 6 inches above the insertion site. Once you have the site, then release the tourniquet and prepare your supplies. The gloves do not have to be sterile. They can be clean gloves. I'm going to draw up some normal saline, and I need to clean the vial since it's a multi-dose vial. Okay. Clean with friction. Push in air. Draw up without touching the plunger. You should remove all air from the syringe before attaching it to the extension set. When you're opening items, you should open them away from you. The port of the extension set is sterile, so you do not have to clean it. Remove the cap and put it back into the sterile area. And prime your extension set. You also want to prepare your tape. And make sure it's on a clean surface. Now I want to clean my insertion site with my alcohol in a circular motion. Now put the tourniquet back on, 4 to 6 inches above the site. Avoid friction and shearing. Now I want to get my catheter. Make sure it's intact and your bevel is up. Apply traction to your vein. Go in at a 30 degrees angle. Once you see blood, lower your catheter. Advance 1/8 of an inch. Then advance your catheter with your non-dominant hand. Release your tourniquet. Apply pressure to your vein and hold the hub. Pull out the needle. Connect the extension set. At all times, the insertion site should not be touched. Then remove the pressure, your middle finger from the vein, flush, make sure the vein is patent. Then you want to tape the extension set. Then the tegaderm is placed over the hub and the IV insertion site. The edges are removed. Disconnect your syringe and tape the end. The end of the port should not cover the insertion site. And you want to clamp your extension set. You need to also label your IV. So you should have your date, time, and initial, and it should be placed on the side away from the insertion site. This concludes the IV.